Welcome everyone. My name is Rhodora. I will be discussing learning theories, health literacy, and cognitive changes in the elderly. The World Health Organization defines healthy aging as the process of developing and maintaining the functional ability that enables well-being in older age. Every person in every country in the world should have the opportunity to live a long and healthy life. Everybody can experience healthy aging. Being free of disease or infirmity is not a requirement for healthy aging, as many older adults have one or more health conditions that, when well controlled, have little influence on their well-being. As physical therapists, we have an important role in promoting healthy aging. We have the ability and expertise in creating environments and opportunities that enable people to be and do what they have throughout their lives. And how are we going to do this? First, we have to ask ourselves these three questions. Number one, how can I optimize opportunities for healthy living in the elderly in the digital age? Number two, how can I assist in promoting and facilitating health literacy in older adults? And number three, what are the strategies and interventions that I can provide to maintain cognitive health to prevent decline and disease? These questions lead us to the importance of education and learning as factors in facilitating participation in society and allowing older adults to enjoy a positive quality of life. Our first topic is learning theories. Learning theories are an organized set of principles explaining how individuals acquire, retain, and recall knowledge. By studying and knowing the learning theories, we can better understand how learning occurs. The principles of the theories can be used as guidelines to help select instructional tools, techniques, and strategies that promote learning. There are three traditional learning theories: Behaviorism, Cognitivism, and Constructivism. Behaviorism equates learning with changes in either the form or frequency of observable performance. Learning is accomplished when a proper response is demonstrated following the presentation of a specific stimulus. In Cognitivism, learning occurs through internal processing and information. It addresses the issues of how information is received, organized, stored, and retrieved by the mind. Constructivism is a theory that equates learning with creating meaning from experience. A new learning theory is Connectivism. Access to technology tools has literally exploded. Anybody around the world can now access top-notch education, and this is how we are doing now in our distance learning. Learning takes place when learners make connections between ideas located throughout their personal learning networks. And how are we going to apply this to our patients? In the next slide, I introduced one of my patients to my YouTube channel where she can watch and learn on health educations that I posted. She can watch it anytime and she will be connected with me even if I am personally present in her home.
Describes as a group of eye and vision-related problems that result from prolonged computer, tablet, e-reader, and cell phone use. At greatest risk for developing computer vision syndrome are those persons who spend 2 or more hours at a computer or using a digital screen device every day. Common symptoms of computer.
Our next topic is on health literacy. Health literacy is defined as an individual's capacity to obtain, process, and understand basic health information and services sufficiently to make appropriate health decisions. Limited functional health literacy among older adults is a major health problem. Without this knowledge, they may not understand the relationship between lifestyle factors such as diet and exercise and various health outcomes. Outcomes of limited health literacy among older adults include incorrect taking of prescription medication, poor chronic disease management, low use of preventive health services, and increased risk of overall mortality. Responsibility for improving health literacy lies with public health professionals and the healthcare and public health system. We must work together to ensure that health information and services can be understood and used by all people. A strategy is to use plain language for making written and oral information easier to understand. It is one important tool for improving health literacy. I had many patients that showed me their medical reports and wanted me to explain what they are. In this photo, Steve is sharing his health report card from his primary care provider, and he was very proud of it. And this is a very nice example of a simple way to inform patients about their lab or medical tests with explanations of what they are at the back of the card. Some of our elderly may have hearing difficulties, and it is important that we speak slowly, clearly, and loudly. Sit face to face, avoid distractions like television, simplify and write down your instructions. Visual aids are very helpful. This is Ed, and he's 100 years old and has low vision, and he is using a reading machine to read his mails.
Signature, and right there.
And that was Ed again. At 100, his cognition is intact. And this leads us to our last topic. Cognitive functions are mental processes that allow us to carry out any task. They allow the subject to have an active role in the processes of receiving, choosing, transforming, storing, processing, and retrieval of information, allowing the subject to navigate the world around him. Cognitive abilities include memory, language, perception, reasoning, perceptual speed, spatial manipulation, and executive skills. Cognitive abilities collectively form the concept of intelligence. There are two types of intelligence, fluid and crystallized. Fluid intelligence tends to reach its peak during adolescence and decline rapidly during adulthood. Crystallized intelligence continues to increase gradually throughout adulthood, even until the 9th decade. In recent years, the view of intelligence has been expanded to include expertise, creativity, and wisdom. The broadened view of intelligence recognizes the importance of culture and acquired knowledge rather than only genetic intelligence. Aging causes changes to the brain size, vasculature, and cognition. The brain shrinks with increasing age, and there are changes at all levels, from molecules to morphology. Cognitive physiologic changes with aging are the following: loss of memory, delayed response time, and diminished ability to learn complex information. The 3Ds, delirium, dementia, and depression, represent serious pathologic impairments requiring detailed assessment and specific treatments, and will not be discussed in this presentation. However, a topic worth mentioning that causes mental changes in the elderly is urinary tract infection. It is one of the commonly diagnosed infections in the elderly, with return visits to the emergency room. Mild cognitive impairment, or MCI, is a condition in which a person has problems with memory, language, or another mental function severe enough to be noticeable to others, and it can be documented in testing, but is not severe enough to interfere with daily life. Recommendations for prevention of MCI are the following: eat a variety of foods, including 5 fruits and vegetables each day. Eating fish as a regular part of one's diet may also help improve memory. Do not smoke. Exercise daily. Regular mental activity may help preserve mental functioning, and social contacts with family and friends may enhance preservations of cognitive functions. In this photo, Marie, 82, maintains her cognitive function by being a Mary Kay consultant and joining community activities like senior tours. Nancy, 80, maintains her cognitive function by being creative with her crafts.
You gotta laugh and joke. Oh, when we get together, our family, we play cards. Euchre
Oh.
and poker.
Oh, I like poker.
Yeah, we play poker and euchre.
Alexa, remind Tony to move and get up every half hour.
Okay, I'll remind you in 30 minutes.
Thank you all for watching and listening. The world is very different now. It is aging, and the advancement of technology is making it smaller as we can easily connect with anyone, anywhere with just a click on the computer. As physical therapists, we have the opportunity to use this new technology in assisting information literacy, thus creating a healthy environment for a better life for our elderly. Health literacy and cognitive abilities independently predicted mortality among elderly community-dwelling individuals. Both reading comprehension and cognitive abilities are likely to be important for gaining health information and interacting with the healthcare system. Most of our communities have senior centers or community centers that need volunteers to assist the elderly population in health literacy. Make time to volunteer and make a positive impact to others. Volunteerism has positive benefits for the volunteer as well as for the community served. Lastly, I had the opportunity interviewing the director of Sunrise Lifelong Learning, a nonprofit organization that plans and offers informal educational programs and activities to enrich the daily lives of its members and others through classes, trips, outdoor activities, and social events for seniors. I would like to end my discussion with this quote from Maya Angelou. People will forget what you said, people will forget what you did, but people will never forget how you made them feel. Thank you.
Hi, my name is Tanya Brink. I'm the director of Sunrise Side Lifelong Learning. We're located in Tawas City, Michigan at the IRESA building, but we do cover 4 counties. That would be Ogama, Iosco, Aranac, and Alcona. We're a lifelong learning center, and our mission is to provide participants with the highest quality, lowest cost programs to foster continual learning and enrich lives. It's a proven fact that lifelong learners are happier, healthier, and live longer. So we're a 501c3 nonprofit organization. Our classes is what we really like to focus on. We have different categories of classes covering literature, history, wellness, I could go on and on and on, but we have technology, several different categories. We are here for people 50 and older. So 50 to, let's say, 110 or more, if you're out there. We try to make everything as easily accessible as possible, and we just, we're all about learning and keeping that learning going through life, and never stop growing. Thank you so much, and we hope that you would consider joining us.